Hello, everyone. My name is Angel Jose, and I'm an undergraduate student here at the University of Texas, Rio Grande Valley. Today, I will be presenting my project, Cross-Border Disparities, a comparative analysis of Helicobacter pylori infection and tuberculosis prevalence in the Rio Grande Valley and Tamaulipas, Mexico. Helicobacter pylori, or H. pylori, and tuberculosis, or TB, are both major global public health concerns. H. pylori is a bacterial infection that affects the stomach and is often spread through saliva, vomit, or stool. While many infections are asymptomatic, some can cause bloating, stomach pain, ulcers, and in very rare cases, stomach cancer. Tuberculosis, on the other hand, is a contagious disease that primarily affects the lungs and is spread through airborne droplets when an infected person coughs or sneezes. TB risk is particularly high in crowded areas and among individuals with weakened immune system, such as those with HIV or AIDS. The Rio Grande Valley in Texas and Tamaulipas in Mexico form a unique binational region along the U.S.-Mexico border. This is pictured in Figure 1. This area experiences high cross-border movement, socioeconomic disparities, and healthcare challenges. Studying infectious disease prevalence in this region helps us better understand how health outcomes differ across the border. The goal of this project was to compare H. pylori infections and tuberculosis prevalence between the Rio Grande Valley and Tamaulipas. We also wanted to identify the social and healthcare factors driving these differences so that future public health interventions can be more effective on both sides of the border. We conducted a comparative analysis using data from the CDC, regional surveys, and published studies. We looked at both disease prevalence and incidence, standardizing values as percentages or cases per 100,000 population. In addition, we reviewed social and environmental factors such as poverty, sanitation, healthcare access, and migration. One limitation we encountered was the lack of consistent surveillance data between the two regions, which required us to sometimes rely on state or national level averages. Our findings showed a clear disparities between the two regions. For H. pylori, the estimated prevalence in the Rio Grande Valley was around 45%, while in Tamaulipas it was significantly higher at nearly 70%, or double as the Rio Grande Valley. This is pictured in Figure 2. For tuberculosis, the incidence in the Rio Grande Valley was around 12.3 cases per 100,000 people compared to 32 cases per 100,000 people in Tamaulipas. This is pictured in Figure 3. These results demonstrate that both infections are more prevalent in Tamaulipas than in the Rio Grande Valley. The higher prevalence in Tamaulipas can largely be explained by socioeconomic and health disparities. Poverty, overcrowding, and sanitation challenges increase the risk of both H. pylori and TB. Limited access to health care also means that infections are less likely to be diagnosed and treated early. While the Rio Grande Valley benefits from a stronger healthcare infrastructure, it still faces challenges such as underinsurance, rural barriers to accessing care, and frequent cross-border movement. This keeps the infection rates higher than the national average. These findings highlight the importance of looking at a social determinants of health when addressing infectious disease burdens. The study shows clear health disparities across the U.S.-Mexico border, with Tamaulipas consistently experiencing higher burdens of both H. pylori and TB. Addressing these disparities requires binational collaboration. Potential strategies include preventive measures like vaccination, sanitation improvements, and greater access to treatments such as antibiotics and TB therapy. Future research should focus on collecting more local, community-level data, forming partnerships with public health organizations on both sides of the border, and conducting longitudinal studies to track trends over time. I would like to sincerely thank my mentor, Dr. Upal Roy, as well as Ms. Deepa Roy and my lab colleagues for their guidance and support throughout this project. Thank you for your time, and I look forward to any questions.